Hi, my name is Dimity. I'm a women's health physiotherapist here at Advantage Healthcare and Physiotherapy in Wynnum. I've been a physiotherapist working in the women's health space for about 10 years, including hospital and private practice settings. And I have experience working in pregnancy, postnatal recovery, scar rehabilitation, pelvic pain, bladder and bowel function, and return to sport. Pelvic floor physiotherapy is a type of physiotherapy focusing primarily around the areas of the pelvic floor, low back, hips, and tummy. When it comes to the muscles of the core, we're talking about the pelvic floor, the diaphragm muscle, which is your big breathing muscle above. We have some deep tummy muscles and the spinal muscles that work together as a unit to help with pressure management and control. So that's talking about things like your bladder control and being able to brace and hold when you're lifting heavy things, for example. It's also equally important that the pelvic floor can relax and unwind when you're at rest or when you're going to the toilet. It's also really helpful for sexual function. The other equally main important job for the pelvic floor is to help support your organs. So it's there to give you a lift and to give you a hold when you're moving really quickly or if you're jumping and things like that. Now, when it comes to pelvic floor physiotherapy, we're doing a lot of education. So when you come in, we talk a lot about what's going on and what we're doing and why, so that you have the tools to understand why you're here and how we can help. Pelvic floor physiotherapy isn't just Kegels or pelvic floor exercises. And the reason for that is the muscles of the pelvic floor are the same kind of muscles that we have in our arms and our legs. It's called skeletal muscle. Now, it's equally important that skeletal muscle can squeeze to contract, but it also needs to be able to relax and lengthen when we're at rest or if we need to be able to reach something. So when it comes to the pelvic floor, its two main functions are to be able to squeeze and brace so that you have good control, but you also need to be able to relax and let go for things such as sexual intimacy. So when it comes to pelvic floor exercises, if you don't need that strengthening and you tend to be quite overactive, we might need to work more on relaxation techniques to help you get access to those muscles to use in the first place. Pelvic floor physiotherapy can help with things such as bladder leakage, like if you're going to try and run or jump or pick up something that's heavy and you feel like you can't control your bladder. It also helps with frequency of urination. So if you feel like you're going to the toilet all the time, or if you're waking up in the night to go to the toilet, we can help with that too. The next thing that we can help with is feeling of heaviness or dragging around the vagina that might be related to having a pelvic floor prolapse. We also help with things like pain with sexual intimacy, or if you've had an experience in the doctor's office where you're feeling like you're experiencing pain with an exam or you can't use tampons. So pelvic floor physiotherapy is really quite unique, and we do have a lot of education during your appointments so you understand what's going on and why. But we do have a lot of similarity with regular physiotherapy too, such as soft tissue release or stretching, and we also help with exercise and relaxation techniques. The main thing here is about we want to make sure that you're comfortable and that you're set up in a nice, relaxing space so that you can enjoy being here. Your first pelvic floor physiotherapy appointment is about getting to know you and understanding what you're experiencing. So when you arrive, what we'll do is we'll start with having you complete a simple questionnaire, which will help guide our questions during your appointment to make sure that we're asking the questions that are relevant to you. We'll be talking about things related to your pelvic floor, but we'll also be asking about things like your health history, your lifestyle, and any goals that you might have to work towards. And we'll be coming up with a bit of a plan for your assessment. So there will be an assessment during your first visit. Now that might be different depending on each individual person and your needs. Typically what we're looking at is initially how you're moving through your low back and your hips, as these areas strongly influence how the pelvic floor functions. We also might be looking at how you breathe and whether certain muscle groups are indicating that we need to address certain areas when it comes to the pelvis. When it comes to treatment during your first session, we might begin with simple things like lifestyle modifications. It could be really simple and really effective, like how you sit on the toilet. We can even potentially do some treatment for some tight muscles, some stretching exercises, and get you started on some home exercise programs that you can begin to help carry you on between your first visit and your next. An internal pelvic floor physiotherapy assessment is not always required, and it rarely happens during your first appointment, although it can be quite helpful in giving us information about what your pelvic floor is up to, whether it's that the muscles are a little overactive and they're bracing a little too tight, or if we need to strengthen them because they're a little weak and they need some help in learning what to do. The pelvic floor internal exam can tell us a bit more about that. Now, we don't use any medical instruments, and we're working in our dedicated private women's health space here, but we will be making sure that you're well aware of what we're planning for that session, and often we're planning ahead so that you can be prepared. And of course, you can always delay it or avoid it if you want to, but it is really quite simple. It's 1 to 2 clean glove digits with a bit of lubricant applied nice and slowly at the vagina. And once we're there, it's just a little bit of pressure on each wall to see what it's up to and how it's responding. And we're always able to chat to you throughout and make sure that you're comfortable. And we can always stop at any time if either it's causing you discomfort or you just don't want to go any further. Now, bladder leakage is common, but it's not something that you have to ignore. You might notice it when you're coughing, sneezing, or laughing. Sometimes you might feel it at the bottom of a really heavy squat, or you might feel it when you're racing to the bathroom if it's coming on really quickly. Now, sometimes the solution is very simple in that it might just be some pelvic floor exercises that we need to help you with to guide you along your way, but we can help you with the assessment and determine exactly what your needs are. It's never too late to start pelvic floor physiotherapy. We can help you at any point across your lifetime. You might consider coming for pelvic floor physiotherapy if you're experiencing symptoms such as bladder leakage, chronic constipation, pain with sex, or perhaps you're pregnant or postpartum and wanting to get back on your active lifestyle journey. We can also help you with scar rehabilitation and getting back into doing the things that you love.